So I'd like to start off by saying good evening and thank you for joining us tonight. On behalf of the Johns Hopkins Breast Cancer Program, I'd like to welcome you to this webinar, An Integrative Approach to Good Health. My name is Alyssa Thorne and I'll be moderating this webinar for tonight. Our speaker tonight is Dr. Harpreet Gujral. Dr. Gujral is an integrative medicine practitioner who provides consults incorporating her experience in modalities like aromatherapy, guided imagery, along with various Eastern modalities such as Ayurvedic medicine, mindfulness and meditation. These are enhanced by her roots in India. Dr. Gujral strongly believes in the body's ability to heal itself. During her tonight, we'll be talking about mindful eating, self-compassion, healthy cooking, mindful pausing, and health coaching that bring together various aspects of integrative medicine. Over the next hour, we'll be talking about how you can optimize your health and wellness throughout your journey. A few quick housekeeping tips before we begin. I've muted your line and turned your camera off. So if you're joining a few minutes late, if you could go ahead and do that, I'd appreciate it. At any time during the presentation, please use the chat feature you see at the bottom of the screen. Your questions will come directly to me and we'll get to as many questions as possible at the end of the webinar. If you miss any of the presentation or would like to watch it again, we'll be sending out a recorded link of tonight's webinar in a few days. And at the end of the presentation, I'll put in the chat feature and show a slide of a survey link. If you could take just a minute or two to complete it, your feedback's important and helps us plan for other upcoming events and programs. So that's about it for me. I'm going to turn it over. Dr. Gujral, could you share your screen?
Yes, thank you. I will.
Wonderful.
Okay. Yeah. All right.
Perfect.
I wanted to start from here, from the beginning. All right. How's the sound, Alyssa?
It's great. It's perfect on my end.
Excellent. Okay. Well, good evening, everyone. This is definitely a pleasure and a privilege to be with like-minded people who are interested in wellness, well-being, resilience, immunity boosting. And Alyssa, thank you so much for having me. I wanted to keep it very simple. So as you can see, I call it the best M's. So it's breathe, eat, sleep, think, and move. So anyways, I just wanted to, make this so much more tangible and, something that we can all do. Even if we had just 5 minutes or 7 minutes in a day, there are things that we can do. I do want to talk about what is stress, good stress, bad stress, and also talk about how does stress actually can affect inflammation. And we know that a lot of chronic conditions are secondary to inflammation, and we all understand whether in breast cancer situation or otherwise, inflammation reduction, chronic inflammation reduction is a good thing. I'd also like to talk about how to lower inflammation and enhance well-being by breathing, eat, sleep, think, gratitude, and movement. Stress, as we know, is it's actually good. It's helps us to get up and look at our things to-do list and actually get through a lot of stuff, show up for the world and things that need to be done. And yet we know that is eustress. If it's good, it allows us to, keep up with what we need to do. However, when there is chronic stress, it actually leads to distress, which has these problems and actually can affect all of the body organs. So it's really important to understand the difference between the eustress and distress, and we'll talk in the subsequent slides a little bit more. I do want to give ourselves some time in the end so I can take questions and maybe have an exchange. So the right amount of stress, we know that stress is necessary. We need that. And this is important for well-being. It's important for us to get through our things. It also helps us through our adequate performance. However, as in this diagram, as you can see, what happens is, so as you see the curve on the it has 4 blocks. On the left side, when there's less stress, then when there's deficiency, the middle one is optimum stress, which is eustasis. And on the right side is excess stress, which is allostasis. And that can actually cause a lot of stress on the body. So stress can, as I mentioned, it's designed to protect the person. For example, if I need to run away from a saber-toothed tiger, stress will allow my heart rate to go up, my muscles get moving faster, and my heart is racing, and I can just run and save myself, hopefully from the saber-toothed tiger. So there is increased oxygenation to the brain, so I can think it through, and my skeletal muscles and heart muscles are, doing better. So that's our fight, flight, freeze reaction. So fighting is very important for survival, and yet there's also freezing that can happen where because of extreme stress, we can freeze in action. And maybe we have a long list of things to be done, and we just are frozen in action, that we can't even move to do what we need to do. The good stress is parasympathetic nervous system. So sympathetic nervous system is the gas pedals, if you will, of a car, and parasympathetic nervous system is the brake pedals of the car. So we need both the gas and the brake. And what parasympathetic nervous system does is it helps us rest, digest, and repair, which we absolutely, all of us need, because we have lots of wear and tear in our body, secondary to just aging, environment, chronic conditions, medications, all of that can cause wear and tear. So we do need to make sure that, both the sympathetic and parasympathetic nervous system is balanced, so we can manage both the fight, flight, freeze reaction and the rest, digest, repair reaction. So that's the eustress versus distress. Now, how does stress become distress? Well, when we are carrying a lot of load, not only am I carrying the load of maybe physical condition, there is environment, there is perfectionism, there is relationships, children. When I was doing this talk for our imaging clinic, and they said teenage kids, that causes a lot of stress. So I have 2 of them, so I can see how they were thinking. So all those reasons and not sleeping all can cause distress. And we know that stressors can be emotional or physical. It's the magnitude of the stress, as we saw in the previous diagram, and also the chronicity that actually, makes it distress or eustress. We know stress can affect several body parts and can cause problems. So stress, Danze Pace says, stress is the trash of modern life. We all generate it, but if we don't dispose of it properly, it will pile up and overtake your life. So I know as a clinician, when I look at stress, it starts from migraine headaches to cardiac problems to IBS, irritable bowel syndrome, to arthritis, to chronic inflammation, lack of sleep, and so forth. So it really can affect all of the body parts. And so our goal is to figure out, how do we strategize to maintain our stress to be eustress and not allow it to become distress, and actually nip it and have things that we can do on a regular basis to mitigate that stress. So as I was mentioning, relaxation response, as you see, the fight or flight response versus relaxation. So as you see the diagram of the face, and you see the arrows. So what happens is, when there is anxiety, the gray arrow from anxiety goes to increased sympathetic nervous system activity, and that leads to worsening of worries. There is more pain. We know science has shown if we're more anxious, if our stress is out of control, our pain actually is worse. we can have a lot of physical symptoms of illness. So what's important is the blue arrows that you see, relaxation response that allows to mitigate or balance that aspect of the fight, flight, freeze response. So it's important for us to activate, multiple times without our control. We have the fight or flight response. And so I think it's important for us to be, as we cultivate mindfulness or more presence, we start to notice that, we are able to mitigate that or balance this much better, because we're able to, find ourselves like, oh, that was like, that was hard. Like I just sensed my, I'm not appreciating that experience. And then noticing in the body and calling it allows us to be mindfully present in that moment and say, oh yeah, that was hard. And then we say, okay, so what do I need to do? And then I'll talk more. So there are specific things that we can do to mitigate that and catch ourselves mindfully in that present moment, call what's happening to ourselves, and then help ourselves to mitigate that response by other practices like gratitude, breathing, and so forth. So relaxation response can counteract the toxic effects of chronic stress. And we know, as I was mentioning, people can have allergic manifestations, eczema, asthma. I mean, all these chronic conditions are not necessarily due to stress, but we know that stress can actually cause, exacerbate, and worsen some of these conditions. For example, headaches, abdominal pain, low back pain, gastrointestinal discomfort, constipation, diarrhea. So it can affect a lot of other body parts. So what is our state of health in the US? As we know, what's happening is with our very fast-paced society, although this changed recently with COVID, for the last 3 months, I think people have found this more of mental pause, mindful pause, of really slowing down and looking at what's important. And yet we know that US Health report card shows that our outcomes are not necessarily as good as other developed countries. However, we're actually spending a lot more on healthcare with a poor report card. So how do we get health? Health comes from, believe it or not, 80% of health comes from our lifestyle. And you might say, Harpreet, okay, so all these behavioral and lifestyle, tobacco, alcohol, diet, exercise, sexual behavior, sleep, stress, I got all that. I'm taking care of all those. I have a good handle on that. And so does that mean I get most of my health in that way? Absolutely. So we know that lifestyle has a huge impact on our health. The 15 to 20% of health comes from medical treatment. We also have a small percent of health comes from the environment. Of course, we need to, know the environment, which is, is it safe? How much chemicals around us? What's put on our body? What's in our, homes? And also the socioeconomic impact. We know education, employment, household income, family support, and safety, all that also impacts our health. So really looking at all of those. Now we know that we don't have control over everything, and yet we can look at tangible things that we can actually control for good health. So how might we manage stress? Well, Ralph Waldo Emerson said, the one of most beautiful compensations of life, that none of us can sincerely try to help another without helping themselves. We know, we've heard of this expression of putting our mask on first before we help others. And I think that really goes along, most women, for some reason, I'm not generalizing, and yet we know as caregivers, as mothers, daughters, team members, leaders, somehow we are wired to take care of others. And in doing so, a lot of times we just, might be sacrificing our own health. And I think it's really, really important for us to pay attention to that and really give ourselves permission to take care of ourselves. And, and maybe this group already is doing absolutely great, and maybe you don't even need to have this reinforced, and yet I think it's important for us to have that conversation. So care of self, we know, is not selfish. It's when we take care of ourselves, when we breathe, we nurture ourselves, we're able to give others a lot more. So I think that, we all understand is really, if service is something that comes from within you, that we can do be of more service when we take care of ourselves. So how does one care for ourselves? I know this is a webinar format, so I couldn't have asked you to, put some answers in the chat section, or all of us in one big auditorium, where I would have asked you, what do you do for your self-care? And you would say, I run, I garden, I jog, I cook, I meditate, I do yoga, I write, I read, I do poetry, beautiful conversations, and lots of answers, good answers. So I think it's important for us to make sure that we're not putting aside this 8 hours or this going on vacation when I'm going to take care of myself. Instead, really sprinkling it throughout the day. So can I take 1 minute here, 5 minutes there? Simple practices that resonate with us are really important to cultivate, and very intentionally build it into our schedule so that I don't have to think about it. It just so happens that this is how my day is going to roll. And we know, we can have all our plans and then everything just goes out the window just because of however the day, brings. And yet, if we have it intentionally established, even though, I might miss out, going for a walk in the morning because I got busy, I can at least breathe, or I can at least practice gratitude. I can at least look out the window, 20 feet away into something green. So really finding our own way of making sure that we're finding self-care practice. So breathing is huge. In fact, right now, as a Healthy at Hopkins champion, I've been doing breathing sessions for our Hopkins colleagues. And I just do 15-minute sessions, 7:30 in the morning, 3 times a week. And it's been wonderful because people can just join in by Zoom and they just breathe. And what it does is it actually oxygenates our breathing. So once we're oxygenating the lungs, we're not only physiologically getting more oxygen into the body, but we're also releasing, carbon dioxide, things that are just sitting in our body. So you're able to release that. One of those breaths are called 4-7-8 breath. And you're welcome to also check out at your leisure, Dr. Andrew Weil's video. He actually has a YouTube video on 4-7-8 breath. The breath is very simple. And we do it 4 times in one seating. It's basically breathing in from the nose for a count of 4, holding for a count of 7, and breathing out from mouth for a count of 8. So 4-7-8. And meanwhile, the tongue is actually behind the top teeth. So it actually just stays there. And we breathe in from our nose for a count of 4. We hold for a count of 7. We breathe out from our mouth for a count of 8. In fact, I would love for you to practice that now so we can collectively do this together. So please follow my counting. And, if you say, Harpreet, nope, not right now, that's quite all right. Please, those of you who feel this will be something worthwhile, it's only 30 seconds and maybe less, so let's do it together. I'll count for you. Excellent. Okay, so we're sitting, most of us are sitting down, so just feet on the floor. And noticing our feet on the floor. So toes, front and back, side to side, just making that connection. And now noticing your breath. So just breathing in, simple breath, breathing in. Notice where the breath is entering and then breathing out. Just regular breathing in and out. Okay, so one more breath. Breathing in, regular breath, and breathe out. Very good. Okay, so now I'll count for you 4, 7, 8. And basically it's breathing in for 4 from nose, holding for a count of 7, breathing out from our mouth for a count of 8. The tongue stays behind the top teeth, like that. Okay, so I'll count for you. Ready? All right. So breathing in, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Breathe out from your mouth, 2, 3, 4, 5, 6, 7, 8. Excellent. Let's do it. Breathe in, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Breathe out from your mouth, 2, 3, 4, 5, 6, 7, 8. Very good. 2 more. Breathe in, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. And breathe out from your mouth, 2, 3, 4, 5, 6, 7, 8. One last one. Breathe in, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Breathe out from your mouth, 2, 3, 4, 5, 6, 7, 8. I'm just relaxed saying 4, 7, 8 breath. Just feel in your body how that lands for you. Just notice in your body how that's landing. And the recommendations are to do 4 breaths 4 times a day at least to start to notice the effectiveness of the breathing. So very good. And the other thing is eating. Did you know that we can turn off certain bad genes by providing the body the right chemical information, which is present in some of the healthy foods? So, which is wonderful to be able to monitor and actually regulate, upregulate or downregulate our genes. So even though we're born with certain genes, there is the possibility for some of the genes to be down or upregulated based on what they do for us. So we know that whole foods, as little processed as possible, can actually offer that chemical information. Those phytonutrients in the whole foods can actually offer that. In fact, I find it's really quite simple and easy to eat the foods because all we're doing is just taking from Mother Nature and just consuming them, either raw or cooked form, and incorporating anywhere from 5 to 6 servings to up to 9 to 13 servings, depending on, our medical condition, our health, our tolerance for vegetables and fruits. We know that, especially in breast cancer, it's really important to eat in a way that we can actually not feed the cancer, which is not eat sugar, especially the sugar that's in processed foods. We can also look into foods like kale, broccoli, the vegetables that are actually, our anti-cancer, like green tea. I love the book that's called Eat to Beat Disease. It's by Dr. William Li, L.I. And he explains how these foods are actually, these phytonutrients are helping us to be more building an environment of anti-cancer, which is wonderful. Psychology of eating is where we're being mindful of what's going into the body. So as you know, some of you might have this relationship with food. I personally do, is when I, have emotional distress or something that's uncomfortable for me, I might choose food. I might actually find myself like opening up the cabinets or the fridge, and saying, what am I doing here? I just ate 2 hours ago. And yet it's my nerves, my emotions that might lead me to, seeking some comfort in food. So I think it's really important for us to know ourselves best and really pausing to know that. And psychology of eating is actually using the food and practice gratitude, using the food as not an emotional band-aid, but using the food for what we said, to upregulate and downregulate our certain genes. And gratitude actually allows the body to assimilate the food in the best way, because remember we were talking about parasympathetic nervous system. So what gratitude does is allows more of the parasympathetic, activity, because it allows for relaxation to happen. It allows for whatever is there right now is enough, because we're experiencing gratitude, in a formalized way. There's a lot of great, scientific literature about gratitude, and I'll speak to that more in subsequent ones. I love this picture. So sleep is our best investment. When people come to us and say, what do I need to do to get healthy? I say, please sleep. Please make sure you're sleeping well. Please make sure you're sleeping on time. Even though we have various chronotype, some are morning people, some are night people, night owls, morning birds, and yet there are like 6 different chronotypes. And yet we know in Ayurveda and in also traditional Chinese medicine, the organs there's a body clock. And organs do their best work when we are able to give ourselves best rest. So ideally, 10 p.m. is a good time to already be in bed. And so that our small intestine, liver, various organs can actually be working, detoxifying, and not feel overtaxed because we're up, we're either eating a snack or we're, consuming media or something else. And the organs are not able to do their job correctly or well when we are awake. So they want us to sleep. In fact, we also know that brain, most of the organization, learning, memory happens when we're getting our sleep. In fact, if we can sleep for 6 hours at least, that's when the trash truck comes. That's when the recycling comes for the brain. That's when they come in and draw, put memories in the drawer, stack, organize, and all that. So I think it's really important to make sure that we're getting good night's sleep. It's also related to what are we doing during the daytime. So I know previously when I was going to school and I was really getting stressed, my sleep was very much disturbed. And so during the day, I started to do 4-7-8 breath. I started to practice gratitude. First, morning light is a great way, the sunshine. It doesn't have to be like, long time because we do have, recommendations not to be out in the sun too long. And yet that morning sunlight for 5-10 minutes, it turns off the melatonin from previous night. And so it regulates the circadian rhythm. So we're actually sleeping well at night and well rested during the daytime. So sunshine is another one. And then sleep hygiene, as I was mentioning, really sticking to a good sleep time, making sure that we're not consuming media, screen time, at least avoiding screen time for an hour prior to bedtime is a good way to maintain sleep hygiene. Avoiding caffeine much later in the afternoon is a good way. I know I mentioned green tea. Green tea has caffeine. It's anti-cancer, and yet it's a good idea to do green tea if you can tolerate it, first thing in the morning and mid-afternoon, but then not to do that later in the evening unless you're doing decaffeinated, which people are still, sensitive to. So gratitude, like I mentioned, every day, tell at least one person something you like, admire, or appreciate about them. Just pause about that. Just, and maybe this is something you do all the time, is appreciating people and mentioning that. That's a beautiful habit. What happens is it doesn't only make them feel good, it actually changes our own physiology. We start to produce the right, neurotransmitters that actually make us feel good. And we don't need to practice gratitude just so that, we can spill those good, feel good hormones. It's really because we mean it, And Melody Betty said, gratitude turns what we have into enough, even more. And I think that's beautiful, especially during these difficult times of, in pandemic, when, we know that there have been lots of challenges, anywhere from PPE to, sanitizers to toilet rolls to groceries to, just really coming back to basics and saying, what is enough? And really focusing on things that really matter to us, that are really personal and matter to us. So it really turning more inwards in that way. So we know that gratitude supports health, and Dr. Robert Emmons has a very powerful research, and it shows that it is good for our bodies, minds, and relationships. And this diagram just says a few things. Basically, it actually leads to a stronger immune system. Isn't that amazing? Like something so, readily available that we can practice on our own, that's free of cost, and it can build our immune system. We're having fewer aches and pains. We have lower risk of heart attacks. We're able to take better care of ourselves. We sleep much more, deeper and longer. We have positive emotions. Our relationships are better. We're more forgiving because we are seeing the goodness. We're seeing what is already there. And so what is missing, what is not right, we're actually turning to seeing what is going well and what is right. So gratitude practice, as I mentioned, Dr. Robert Emmons at UC Davis has a lot of research on that. Their website has a lot of resources. And so simple way of practicing gratitude, which most of you are likely practicing already, is having a gratitude journal. And so just writing 3 good things, that you're grateful for. It's also another way of doing a group text or sending an email or thank you notes and thanking someone about what are we grateful for. And I know right now, during these very difficult times, there's so much generosity that has been, created. There's so much giving and sharing that has happened. So we can see how gratitude can easily be utilized in our daily practice. So Robert Louis Stevenson says, don't judge each day by the harvest you reap, but by the seeds you plant. So in gratitude, in abiding with what is already there, what is right, hope arrives on the horizon each morning in the form of a brand new day. And we know, without sounding cheesy, we know that's why it's called present. Another way of keeping our stress, and lower, and also our immune system stronger, is movement. If I could write one prescription, well, actually maybe 2 prescriptions, I would write one for movement, and I would write one for sleep. It's like, I know food is important, and yet movement is so important at so many levels. We know that movement helps with physiological benefits, improved circulation, lymphatic drainage. We know that we have receptors on the skin, and there's also fascia. So when we stretch, we're able to move, and the whole body is able to communicate with itself. We know our immune system gets stronger, so it has more vigilance, and it notices what's not right. It's able to delete things that are not right, which is wonderful. And we also know it helps with the mood. we know it helps maintain healthier weight. There are various forms of movement. Do the movement that you enjoy that is best suiting your lifestyle. So it doesn't have to be exactly what my friends, my sister, my brother, my family does. It's really what is that appeases me, what makes me happy. So, finding those movements. NEAT is an acronym. It's non-exercise activity thermogenesis. So it is the amount of energy we burn in the setting of not exercising. So one, I'm saying exercise because it's really healthy for us. Number two, I'm saying is also practice NEAT, which is non-exercise activity thermogenesis. It means how much are we moving the rest of the day in addition to the 1 hour or 30 minutes or 15 minutes of exercise we do, based on how our bodies are, and maybe any limitations. So I think that's really important. Creating good health, so movement can be walking outside, yoga, qigong, tai chi, dancing, stretching, hiking, running, gardening, sports. It could be anything, any movement that allows us, joy and physical and psychological joy. So daily practices, as I was mentioning, in the big summary, is breathing 4-7-8, is eating mindfully, moving, is sleeping soundly, it's paying attention to our mindfulness. What emotions are we going through? How is that affecting us? What we do, what others are doing around us. A gratitude practice. Journaling is another way of being able to pen on a piece of paper. It's an invitation, as we know, a pen and a paper of what's going on. And journaling helps clarify and clear our minds, and also helps with a lot of our through that self-expression, allows us to empty the body of its emotions that are not serving us. So there's a lot of literature now about that, is, when the body says no, or the body is watching. And I think it's really important to make sure that we are journaling to get that out of our system. Self-compassion is another one. What is my narrative? What am I saying to my own body? When I look in the mirror, what am I saying? Am I saying things that are supportive and kind, or are they things that make my body cringe? What is my narrative? If am I saying my body has, been not cooperative, not supporting, or am I saying, body, I'm here for you. We are in this together. This is a hard time, yet we're going to do everything to, in our control to manage the health and well-being. And so I think that's really important to make sure. The other thing is relationships and, that are nurturing. So really surrounding ourselves with relationships that nurture, making sure that we are finding ways to feel, joy and happiness. Physical and mental decluttering is another way. Biofeedback, like heart rate variability, which has been known to, it's heartmath.com, is yet another resource. And in there, we know that heart rate variability is not like arrhythmia or something. It's really that every heartbeat is slightly different than the previous one. And in that, we find coherence, which is the mind and heart, brain and heart coherence. So when we're breathing and the heart rate variability is healthy, we are more resilient physically and mentally. So it's a biofeedback. You can check it out on HeartMath, MATH website. Acupressure is another one. So mindfulness, as I was mentioning, is actually paying attention to the awareness on purpose in the given moment without any judgment. So I'm not saying, oh my God, I can't believe, I'm thinking in this way, or I'm just doing this. It's really without judgment. It's noticing like, oh, I'm feeling angry at this time, or I'm feeling upset at this time, or I'm feeling joyous at this time. And there's no attachment to actual the feeling. It's just getting curious and paying attention to the body and saying, oh, what's going on? So mindfulness is actually a great resource. In fact, I had to do this for school, and I have to say it's been really helpful for me personally to have this practice on a day-to-day basis. It's really allowed me to be a better leader, a better healthcare provider, a better family member. So interconnectedness, it's really important that we are all connected. Mother Teresa said, if we have no peace, it's because we've forgotten that we belong to each other. And I think in this setting where we're all together, I think, we're creating this interconnection and this harmony. And we know that allows us also to, bring more peace and, and not engaging in things that, really bring our energy down. That includes gossip or letting somebody else talk about somebody else. It seems so petty, and yet it really paying attention to our energies and our heart and our body. When we start to become more mindful, it's really interesting to see when something doesn't sit well, the body just gives a message and says, oh no, we don't like this. So caring relationships that nurture are really important. I love this picture. It's so adorable. So there are lots of resources for well-being and self-care. There are apps, there are websites, there are handouts. There's Insight Timer, there's Calm app, there's tapping, there is Headspace, and so forth. There's 10% Happier, there's meditation studios. Some are subscriptions, some are not. There's a lot of all those, things that we can do virtually or in person. The fact is that these are very small things that we can do just on a daily basis and find ourselves really, having that connection. So Barbara and Kipfer, I will close with the quote. It says, "Feel the simple joy of being alive and share it with everyone you meet today." Isn't that so precious, to be alive and sharing it with everyone we meet today? So with that, I will pause here for questions, and I will stop sharing the screen. Melissa.
That was fabulous. Thank you so very much. I just love hearing you talk. So thank you again for that. So I just a couple of things that I was thinking about as you were talking. As you first started, you mentioned self-care isn't selfish. And for me, that really resonated. I think you're right. As a lot of us are joining our moms, or as women, we sort of feel like we were meant to be selfless, and I think that's really, really important to remember, sort of, again, putting your own oxygen mask on first. You mentioned green and going outside, and I think given the current COVID epidemic, we've had a lot more opportunities to do that, which has been really nice. But I still think that, it's really important. I always say go out every day, just even for a little bit. But I love what you said about even trying to see green space from your office, from your window. And I think that's important to remember, that if you can't get outside because you're not feeling well enough, or you have got other demands on your time, you can sort of be one with nature, even if you can't get outside. The 4-7-8 breathing. One thing that I thought was really interesting was that it's something that I try to practice when I can't sleep at night, or when I'm waiting for a new scan or waiting in a doctor's office. I think that's a really helpful tool. So I could go on and on about all the different things that you're talking about, but I guess I would just go ahead and jump into some of the questions I'm getting. As a reminder for those of you who are joining, if you have questions, please use the chat feature, send them to me, and we'll get to as many questions as we can in the next 15 minutes or so. So the first question I'm getting is about green tea. So I thought that was really interesting how you said the importance of green tea. Can you talk a little bit about how one picks quality green tea? And you mentioned caffeine being an issue. What would you suggest in terms of either trying to dilute it or get decaffeinated green tea?
Yes, thank you. Thank you. You summarized it so well, Lisa. Thank you. So green tea has ECGC. It's a chemical that's anti-cancer. And doing our search and looking for a good quality tea, there are some tea enthusiasts who say, I would never do a tea bag, which I personally do tea bags, I do buy loose green tea that's organic, and it's wonderful to actually just steep it and, in a kettle, maybe in a cup, and just enjoy and make that your self-care practice, like really making a cup of tea, and so I use some brands like, Numi and UMI, or, David's Teas, I think it's called. But, like looking for tea that has less likelihood of contamination, because we don't want it to be contaminated with something else. And then if you are sensitive to caffeine, to just go ahead and do that first in the morning, and or consider decaf green tea. And so we can get good green tea that's been decaffeinated as well. Green tea extracts, not so much, not so great. It's really ideal, when possible, to just do the tea leaves instead of the extract.
And beyond your concerns or your warning about caffeine, can you have too much of a good thing with green tea?
Yeah. So, so we know when the studies were done, they were looking at up to 4 cups of green tea.
Got it.
So it's, if someone is able to tolerate that, go for it. I know personally, I can just do 2 cups. After 2 cups, I'm done. I don't think I can do a third one. So really, it's up to you, listening into the body, making sure you have spoken with your healthcare provider, and making sure that there is, no other contraindication for green tea.
Great, thank you. We have a question about NEAT practices. Can you talk more about that acronym and what that means?
Yes, certainly. So it's non-exercise activity thermogenesis, meaning the amount of energy or calories we burn while not exercising. So what am I doing for the rest 23 hours? If I exercise my 1 hour in the morning, I got that done. What am I doing the rest of the day? If I'm sitting at a desk job and that's all I did not get up and take a break, I haven't stretched, I haven't moved, then it's really not so great. Yes, it's good that I walked or I exercised for an hour, but it also is important that, to notice what are we doing the other 23 hours a day. So you'll say, okay, Harpreet, you said to sleep for 8 hours. So we only are left with 16, and then I'm working and I have all of these other things. So if it's possible to almost be a little inefficient. Putzing around the house is great. Like forgetting, so it's really not bad that we forget sometimes. What did we come into this room for? Why did we go downstairs? Why are we here? And you go upstairs and you remember, oh, that's what I need to get. And you run back down. So it's wonderful to be able to move and stretch. So when if I'm working from home, I sit down, I put a yoga mat, I sit down, I'm doing my emails, I put my, Zufu pillow, I stretch my legs, I move. When I'm on a, call, a conference call, I walk, I'm moving. For example, I think I saw someone else walking during this talk. So that's a great way of getting some fresh air and movement. So does that did that help?
No, I think that's really helpful. And I liked what you said about sleep and how important sleep is, but also that 10 o'clock sort of witching hour, if you will. I definitely heard from a lot of patients recently that given, again, with COVID and sort of schedules being different and not having to have a mad rush out of the house in the morning, people are going to bed a little bit later. However, you're right, that trash truck still does come at 6 o'clock in the morning. And so again, with all the stress that a lot of us are feeling right now, I think it is really important to sort of look at those things by being active and getting the right sleep. But I think that the idea, again, of sort of multitasking is really helpful. Take that call a girlfriend while you're walking, or stretch during a call or whatever. That sounds like a really great option. So yes, very helpful. We have a question about sugar. So I know you mentioned in your presentation to avoid or minimize sugar, and it definitely could tell that we would be getting some questions about that. Do you recommend that there should be no sugar in the diet, or is it still okay to have that birthday cake every once in a while, or put a little bit of sugar in your coffee?
Yes. It's always a balance. It's really looking at the big picture.
Got it.
And I don't think we should seek for 100%. That can cause craziness, I think. But maybe there are some people, and I really admire you if you're doing this 100%. There are people who've said to me, Harpreet, for the last 17 years, I have not had one speck of sugar. Only do fruit, and more power to them, because I know I personally cannot do that. Mm-hmm. But I would say if your sugar is coming from a natural source, better than so if it's coming from a date, a fig, it's much better than having it coming from a candy, or so it's really looking at the big picture and saying, where do I find my balance? It's my birthday, my goodness, we're celebrating, and my daughter baked a cake. Mm-hmm. I'm not saying no to it. I might do a smaller slice, I might do a sliver, I might balance it out with something else. So really using, that balance.
So it's like everything in moderation is really key. And
Exactly.
I know you talked a little bit earlier in your presentation about sort of what I would call stress eating. And I didn't even realize until a few years ago that I do that too. And I tend to do pretty well without sugar until the rails come off and I get a little bit stressed out, and then I'm reaching for that piece of chocolate. So again, knowing that about yourself, I think is good, and knowing that moderation. And I heard you talk in your presentation about not striving for perfection, which I think really is important. So I think that's.
Yeah. Because what happens is when we strive for perfection, then it becomes like, oh, I lost anyways, might as well just get off the wagon and just go with it,
Yeah.
So we are not allowing ourselves to get off the wagon in a way. We are holding ourselves with a lot of compassion and saying, it's okay. This has been a rough day. It's really okay. What do I need? And so because I know I'm an emotional eater, I ask myself, okay, Harpreet, what do you need? Mm-hmm. It might be like, oh, I want to go outside. I want to go check out my vegetable garden. Mm-hmm. I want birds. I want to, some music. I want to put some aromatherapy. I want to just, I want to use jasmine essential oil or rose that nourishes me. So really nurturing ourselves with other forms of things that we feel, more at home. Yes.
This idea of almost what fills up your cup. And maybe it's not always food. It's not that candy bar, but it's other things that sort of your body craves for pleasure.
Exactly.
And that actually brings me to another question that's sort of similar. What you were talking about gratitude. And so the idea of one of the people that are listening talked about the gratitude journal and how important that's been in his or her life. And I wonder if you could talk a little bit about other ideas of ways that you can give gratitude throughout the day to sort of, again, feel like you were taking care of yourself and then more able to take care of those around you.
Yeah. So I actually, since COVID happened, it was really important for me to wake up in the morning and say, instead of saying, oh my God, what happened today? Should I look on Hopkins website? Should I look on CDC? What's happening? What's on my to-do list? I said, Harpreet, what are you grateful for? And Harpreet, can you smile? So I start with a smile in the morning. And fake it till you make it. So I smile in the morning and I say, okay, I'm grateful for this. It could be simple things. My bed is so comfortable, or I slept through the night. I didn't have to wake up, or the birds are chirping. It could be just anything. And as the day progresses, I find gratitude in, oh my God, no traffic today. Or, this person is so kind and so generous. Or, just finding little things of gratitude. And I think it just becomes where, we get wired to look for gratitude. It becomes a practice. Our brains are Velcro for negative and Teflon for positive. And so we're kind of transferring it into, changing it around and saying, okay, what is positive right now? What do I look for? So.
What a great thing to say, fake it till you make it. And I have to say that there was a couple years ago where I was going through a really difficult patch in my life, and someone suggested I keep a gratitude journal. And I remember being so angry and thinking, the only thing I'm grateful for is this pillow, because nothing else in my life is good. And sort of just finding anything that you can be grateful and starting small, and then inevitably those little things became so much bigger. So what a great practice to start your day, and it started with a smile. What a wonderful thing, and what a wonderful thing to greet yourself with in the morning and those around you. So that's wonderful.
Thank you.
I want to switch gears a little bit and talk about the roles of inflammation. So we talked a little bit in your presentation about food and how that may cause the anti-inflammatory or inflammatory diet. Can you talk a little bit about what you suggest about that?
Yes. So I get very excited about that. I follow Dr. Andrew Weil's food pyramid, anti-inflammatory food pyramid, and which is, as we know, is the widest of the pyramid is fruits and vegetables. So really doing lots of berries, not lots, but doing it regularly. So organic berries that are not ridden with pesticides. They can go on your oatmeal. They can go into a smoothie. They can be eaten just like that. And then also vegetables. So cruciferous vegetables, your broccoli, cauliflower, kale, and just incorporating them. Right now, it's just great. It's farmer market season. In fact, this Sunday we went to the farm and picked some broccoli. It was really good. So really finding ways of incorporating that. Whole grains is a great way. And then lentil soups, like crock pot, one dish, big salads. And by the way, chocolate is great if it's just 80% or 90% raw cocoa. I think it's great. It's a mood enhancer. It actually helps with weight. It's increases your HDL, your healthy cholesterol. So chocolate is really not bad.
Music to my ears.
Yeah, Asian mushrooms are really, really good. If you can tolerate Asian mushrooms, those are anti-cancer. So those are really good to incorporate into your daily, diet. Tofu is yet another one. So tofu that's not processed per se. So it could be soy milk, it could be tofu, it could be edamame. So that could be just a snack. When I reach for a popcorn, maybe I'll just do edamame instead. So just for different ways of incorporating. At this time, what's happened for me is I used to be someone who was very content with just doing a TV dinner, and I thought, I was eating so healthy, and it's okay back then that I was doing that. And yet right now we know the more, or the less unprocessed our food is, the better for us. And I'm finding simple ways of how to find, how to incorporate as many of those phytonutrients that we were talking about, different colors, rainbow colored fruits and vegetables that are natural, colors that we can incorporate. So it allows me to not even worry about what I'm not eating. I'm depriving myself of all those unhealthy things that I used to eat. I'm looking at all these things I need to incorporate in a very healthy and happy way, joyous way. I'm not like getting stressed out about it, but I'm just excited and looking forward to biohacking, giving my body this chemical information that can help some of our cells to, be healthier and watching out for optimal immune system working condition.
That's really helpful. You said a few minutes ago, everything in moderation, which I think it really resonates, at least with me, and I'm sure a lot of our members that are watching right now. Are there any things that you would avoid eating? Is there anything that's sort of taboo, don't touch it? Or is it, again, everything in moderation?
Yeah, so I can't think of anything. I would say, if I had to say something, it'll be sugar. Mm-hmm. So occasionally, only very small amounts. And I shouldn't feel like, okay, let's say, I'm going through a very tough time, and maybe, someone has told me like I have, these many days to live. Like, I am not going to, say, okay, Harpreet, no sugar, I'm not going to. I think it's really important for looking at the big picture of our own picture, right? I think it's important for it to say, like, what does sugar do for me? So I personally, sugar makes my joints hurt. I can wake up in the night and feel my joints are hurting because I ate sugar the previous day. So really, so I can't think of any food that's taboo per se, but I would say if we can avoid eating sugar, that would be a good one. I know there are some vegans, who are saying it's also good to avoid a lot of dairy, if possible, like milk, because theoretically, maybe there are some hormones because they come from a pregnant cow, something to consider. And so I personally, one of my friends who grew up in a farm said, Harpreet, I grew up in a farm, I don't drink milk.
Wow.
I drink soy milk, so we have so many options now, almond, soy, oat, Anyway, so speaking with your dietitian, with your healthcare provider, I think is a great way. But I can't think of, foods that, we absolutely should never touch.
Okay. Well, that's good to know. We're very close out of time, but I have one more question that I was hoping we could talk about. It's going to be a very open-ended question, but as I'm listening to you talk, I think, wow, everybody needs a Harpreet in their life, and everybody needs someone like treating them. If someone who's watching us and interested in how they can find an integrative medicine provider, or how they can incorporate some of these things in addition to the other conventional treatments, what would you recommend as a place to start?
Yes, certainly. So we know we have lots of great resources. The Dr. Rosie Scheinberg is my partner, and she's at the Johns Hopkins Main Hospital. And so the email there is heal, HEAL, @ Hopkins @jhmi.edu, and I can send that to you.
Great.
We have, if you are getting your care at Sibley, we have an amazing dietitian. Her name is Hillary Bartlow, and so she's available also to meet with and to talk about diet. So that's wonderful. Also, we have several, and I'm sure your wealth of resources, there are great resources online to look for. We know that are wonderful resources. So, I would say, search in your area, integrative medicine. Definitely Dr. Scheinberg is a great resource at Hopkins. We have at Sibley, a wonderful dietitian, Hillary Bartlow, who can also help meet with you and provide more information.
Wonderful. Harpreet, this has been so wonderful. I feel like I could talk to you all night. I do want to be sensitive to people's time, but again, I really do appreciate you taking the time and speaking with us tonight.
Thank you.
For those of you joining us at home, as I mentioned, as you see on your screen right now, there's a survey. If you could click on that survey, I'm also going to send it out tomorrow. Again, it'll take just about a minute. It will help us plan for other webinars. We want to hear what topics you'd like us to consider in the future and how we can better serve you. And finally, in addition to this webinar tonight, we've got a couple other webinars that are coming up. This coming up Friday, we have a webinar on breast cancer treatment implications during the COVID epidemic. Those are for patients that are currently in treatment. The following Friday, on the 26th, we have a webinar with breast cancer follow-up and survivorship care in the era of the COVID-19 epidemic. And then next month, this seminar series will be talking about managing sleep and fatigue. Again, definitely something that Harpreet talked a lot about, have some strategies we can do to improve our sleep and hopefully mitigate fatigue going forward. And in August, we'll be talking about mindfulness and meditation. Again, something that Harpreet talked a lot about. So again, a lot of topics. To register for any of these webinars, they're free of charge. You go to the website you see here. It's also how you registered for this website. Again, Harpreet, I just want to thank you so much. This has been wonderful. Thank you at home for joining us. I hope you have a great evening.
Thank you all. Take care. Have a blessed day.
Everyone.
Yes, take care. Bye now. Thanks, Alyssa.
Thank you. Bye-bye.
Thanks. Bye-bye.
Thank you.
Thank you. Thanks. Bye.